Hi, everyone. I'm Shivangi. Nice to meet everyone joining the meeting today. I'm excited to share this topic on spinal cord stimulation for spinal cord injury. It is a topic that's at the intersection of neurology, neuromodulation, and neuro blood stimulation is not just for pain. That's what the topic is going to be about. It is now being seen also for motor recovery after spinal cord injury. So this is an active area of research, and I'm going to walk you through some of the science and key studies and where we stand now with this topic. So starting with spinal cord injury, just the clinical background, it's a devastating neurological illness, affects over 300,000 people in the US. It most commonly results from trauma, especially motor vehicle accidents, falls, or sports injuries. And it can also be seen otherwise non-traumatically due to tumors, infections, or vascular causes. Now, depending on the level of the injury, severity of the injury, patients can experience different symptoms like paralysis, sensory loss, autonomic loss, including bladder, bowel, and autonomic function. Depending on the level of dysfunction, you have the Asia impairment scale of spinal cord injury. And then on the right, you see the image, which shows that depending on the level of where the injury occurs, you have the various spinal cord injury syndromes that we know about. Now, motor and sensory recovery after spinal cord injury is especially limited beyond, I would say, like the first year, after which spontaneous recovery, it kind of plateaus. So this makes spinal cord injury a lifelong chronic condition with significant disability and as well as emotional burden and a lot of financial costs as well. So in this talk, I want to explore a promising avenue that is currently being researched, spinal cord stimulation, as a potential way to tap into whatever residual neural circuits remain and to promote motor recovery in patients with chronic spinal cord injury. So a little bit about spinal cord stimulation, or SCS. It's a technique that delivers, as you see, electrical impulses in the dorsal column of the spinal cord. It was traditionally and is traditionally used to treat chronic pain, especially conditions like failed back surgery syndrome or chronic regional pain syndrome. But in the last few years, it is now being looked to explore possibly for motor and sensory recovery, as I mentioned. Can this technology possibly do more than just fix pain? So if we can stimulate and modulate neural circuits below a spinal cord injury, would it possibly be able to restore some degree of voluntary motor control? That's the question we're trying to ask. I know there's only just some of us in the present in this meeting today, but how many of us have seen a patient with spinal cord stimulator placed, maybe in the past month? Okay, so it's more common in certain areas, I would say, and it's more commonly being used now. And so this was just a little bit about spinal cord stimulator, right? So now that we know what it is as a technology, I'm gonna try to talk more about how the exact mechanism is of how it would possibly improve motor recovery. So the key idea is that even after injury, the spinal cord would retain some degree of functional connectivity. And it retains some degree of functionality, and it's just that functionality is dormant, I would say. So what spinal cord stimulator is going to do is it's going to reactivate these networks, especially those responsible for motor function like walking, rhythmic movements, especially like walking or stepping. So what the stimulation does is it increases the excitability of locomotor circuits present in a specific section of the spinal cord where the stimulator is present. And you can kind of think of it as like turning up the volume on whatever remaining signals are still present at that level. And this kind of helps to amplify any residual input from the brain or the environment. So how this seems to act is, this is just a proposed mechanism, right? How it seems to act is it enhances sensory motor integration, as you see here. So we knew that typically the spinal cord stimulator, it acts on the dorsal column, right? So that is the sensory part of the spinal cord. So what we think how it helps in motor recovery is that it enhances the sensory motor integration, where afferent feedback from movement helps to further facilitate motor output. And this is not just, it's not a magic switch that the spinal cord stimulator just turns on the sensory motor integration. It generally requires some residual descending input to remain. So that is from the cortex, or like from a higher structure. Uh, this is why actually most successful trials that have happened for spinal cord stimulator for spinal cord injury have been in patients who have had incomplete spinal cord injury, rather than complete. Although we have seen some trials that where patients with complete spinal cord injury have still regained function. So let me introduce you to this patient. It's a 35-year-old man who had a complete motor spinal cord injury at the T7 level, and he had no voluntary movement below the chest. He was wheelchair bound for 4 years, and as part of a clinical study, he enrolled in this intervention of epidural spinal cord stimulator, paired with intensive rehabilitation. What do you think happened? Just for a second, think about what's the likelihood of someone with complete spinal cord injury, complete paralysis below the chest level. What's the likelihood of him regaining some function? He's been like this for 4 years, right? Yes. So he enrolled in this study, and it was a spinal cord stimulator paired with intensive rehabilitation. That's the important part. The latter, the intensive rehab part, is very important to mention. So what happened is, during physical therapy sessions with the spinal cord stimulator turned on, this is important as well, that the spinal cord stimulator had to be turned on, the patient was able to stand with support. And over time, he progressed to just making small steps. And then eventually he was able to walk short distances with assistance. So what is interesting is that while the stimulation was on, the patient was able to initiate and control movement, but when the stimulation was turned off, his motor function stopped, right? So this is the important aspect of this trial, that the spinal cord stimulator being turned on, combined with the rehab being that he was being made to walk, or assisted walking was part of the rehab. So this shows that the stimulation doesn't just regenerate the spinal cord, it doesn't create these new circuits, it enables existing circuits to reactivate. Now, this study is actually one of the most well-known studies for spinal cord stimulator for spinal cord injury. And it was published by Wagner and his colleagues 2018, and it came out of a Swiss group. So there were 3 patients in the study, all had chronic spinal cord injury, and they applied a targeted spinal cord stimulation protocol, again, combined with gait training, as you see in this picture. What made this study unique was the use of activity-specific stimulation patterns, meaning that different circuits were activated depending on the intended movement, like walking versus standing. So here you can see how there was this implant and the lumbosacral spinal cord region, and how the system of the spinal cord stimulator integrated with the external sensors. These are all the external sensors, the EMG and like the 3D kinematic, like the cameras and everything that was sensing the movement. So both of these combined, it shows how both of these integrated to decode motor intention, as you see over here. All of these external sources I'm just going to move this camera a little to the side. It decoded motor intention and whatever residual kinematics or whatever the intention of the patient is, however they're trying to move. And in that way, it stimulated those specific muscles and to complete rest of the movement. So this study was actually, as I mentioned, one of the main studies, and it shifted perspectives on how potential of recovery of patients with longstanding spinal cord injury. Let's talk about two more studies. These are also very relevant studies in this field. So this other study done by Hargema. It's another one of the landmark studies. Here, there were 4 patients studied, and they all had motor spinal cord injury. Spinal cord injury, meaning that there was no voluntary movement at all below the level of injury. And all 4 of them had epidural spinal cord stimulation, again, paired with intensive physical rehab. And what's remarkable is that at the end of the study, all 4 patients, this is actually a picture from this study, and I tried putting the video in, but it was it was 3 minutes long. But if you're interested, please just copy paste the link and look at the video, and you can see how these patients recovered throughout the process of the study. So as I was mentioning, what's remarkable is that all 4 patients were able to regain the ability to stand and take steps with support, again, when the stimulator was turned on. So again, this is the concept I'm repeating. It's important that the stimulator is turned on during the rehab. Another study I'd like to mention as well, this was just a single subject case report. And this showed where a patient, again, with chronic spinal cord injury underwent longitudinal training with spinal cord stimulator. And longitudinal, how they were followed up for a long time, and there was improvements in motor function, especially in the lower extremity motor score, the LEMS score, and a gradual increase in voluntary movement control. So all of these studies and all of these trials, what they've shown is that how spinal cord stimulator can help with volitional movement, which is movement that is done with intention, and not non-volitional movement, which would be movement that is probably elicited through a reflex or passively. So just wanted to make that clear as well. So this is a new and upcoming field. And so obviously there are several limitations and considerations which make it that way. So just to acknowledge those, first of all, this is not spinal cord stimulator for spinal cord injury for motor recovery or anything like that. That is still considered an experimental field. It is not yet a standard of care. We should remember that spinal cord stimulator is typically, the FDA indications are for, like I mentioned, for chronic pain syndromes like failed back surgery syndrome, so on. Secondly, obviously the therapy itself, the spinal cord stimulator, it's minimally invasive. It's still an invasive surgical procedure, and it comes with the potential risks, one of which I've shown a picture of. It's actually showing how the lead of the spinal cord stimulator migrated, just moved in position. That can cause its own series of complications. Thirdly, even with stimulation, I kept insisting on this fact that structured rehabilitation is a very important aspect to pair up with spinal cord stimulator. So structured and disciplined rehab. And the expo, I'm going to create research centers. So it's, again, patients who want to try this out, they're going to have to travel or look for a research center where this could be an option. So this is a promising field, but it's just in the early stages of clinical translation. So I have a quick scenario here, and I wanted one of you on the call right now to tell me what you would recommend in this case. So this is a patient with chronic spinal cord injury at level T10, who has intact sensory pathways and is asking about clinical trials, right? So they're interested in getting, in improving motor function, possibly pain as well, but maybe they're more interested in improving their functionality. Important to mention, sensory pathways are intact. What would you advise? Would you refer them to take the clinical trial? Would you tell them they're not a candidate due to the chronicity of the spinal cord injury? Would you recommend to just continue rehab without any spinal cord stimulator? Or do you think it's insufficient evidence to advise?
Refer to clinical trial if available.
You would say refer to clinical trial if available?
Mm-hmm.
Okay. Yeah, I would think so as well. So again, important considerations and why, yes, they are a candidate for clinical trial. First, chronic spinal cord injury, right? Most published studies on these trials have focused on chronic thoracic spinal cord injuries, and this patient falls into that category because we have evidence on this specific kind of injury already. Second, like I mentioned, it's important to have sensory pathways. Why? Because we know what the mechanism of spinal cord stimulator is. It acts on the dorsal column. It acts on the sensory part of the spinal cord. That's an important reason why we need the sensory pathways to be intact in patients who want this to be tried out. So, yeah, so there is several inclusion criteria, and it's important to set realistic expectations when thinking of this as a treatment. So where are we now? What's happening in the world now with SCS for SCI? There are several research groups. They're trying to expand access to spinal cord stimulator, and some are even combining spinal cord stimulator with brain-computer interfaces, or BSIs. And there's a number of ongoing trials, and some have been completed. There is this one trial that I'd like to mention. It's the Uplift study. This was done in Miami. It's like the ARC Uplift trial, I would call that. It showed how transcutaneous spinal cord stimulator was able to improve upper limb function in patients with chronic cervical spinal cord injury. And they applied this across multiple research centers where they made this available to patients as a trial, and it did show improvement. Similarly, there was another trial done, ARC trial. It was done in patients with complete tetraplegia, and it demonstrated significantly meaningful gains when, again, paired with rehab. Also in patients with long-standing paralysis. So this is something that we wouldn't have seen maybe 20, 30 years ago, and I find it very, very fascinating that patients who thought that they could never move again, maybe 20, 30 years ago, we now have all of these trials and these opportunities for them to try this specific sort of treatment out. There's another research being done at Mayo Clinic, which is now comparing transcutaneous spinal cord stimulator to epidural spinal cord stimulator, again, for regaining motor functions in patients with paraplegia. So we are now kind of going more in depth and trying to see what sort of spinal cord stimulation helps, but we have some results already. Important to remember, though, it's still not an indication. It is not a standard care treatment, like I mentioned. And yeah, so more about just this neuromodulation in general. There are lots of studies that are pairing brain-computer interfaces with spinal stimulation. So it's brain-spine interface. That's what we're going to call it, BSI. And this is, I think, very exciting. It's even more fascinating, the spinal cord stimulator. It is a way to directly connect the brain and spine communication and kind of bypass the spine. This illustration is actually from an important recent study done by Nature. And it shows how a fully implanted brain-spine interface complex in a patient with chronic spinal cord injury. Here you can see the cortical implants. I'm not sure if you can see my arrow, but there's cortical implants that were surgically placed over the motor cortex to record the high resolution brain signals, right? And these signals were transmitted wirelessly to a wearable processing unit, as you see over here. And this would activate the appropriate motor circuits below the injury level. So say over here, it was at the lumbar level. So in this patient, where this study had been published in Nature, he had complete T7 spinal cord injury and had been paralyzed for years. He was able to regain overground walking with support. And this was again proof that how brain controlled movement can be restored even after complete spinal cord injury. So it's spinal cord stimulator with just even more technology altogether. So again, to force the concept, it's important to remember that there should be residual and anatomical connectivity present, and as well as intensive structured rehab. But still, I think this field is very exciting and it offers a glimpse into just where the world is going now with AI and just technology and everything else. And it's I think it's really cool. So just to wrap everything up, it's important to remember spinal cord stimulation does not regenerate any spinal cord, like the structure itself. You can unlock function that previously thought was not possible, residue, and this makes, I think, spinal cord stimulation a powerful tool. It's not, again, not yet standard of care, but there's more and more emerging evidence, more research being done, and I'm happy that I was able to share this topic. And me if you want to discuss more about this topic, or if you have any opinions and maybe want to know more information. I will be more than happy to discuss this.
Dr. Sai is here.
Thank you, everyone. And these are the references I used, and I'll be happy to discuss or have any questions answered.
Thank you very much. Okay. Can you clear your screen, please? Start recording.